Good evening, everyone. You are welcome to Talking Health with Dr. Laz, your favorite health program on television. Of course, you know that every Tuesday, this is what to tune into at 6:30 p.m. My name is Dr. Laz Eze, and still reaching you from your channel of choice, the African Independent Television, AIT. Yes, today we are coming with another interesting topic. If I may ask a question, what is the largest organ in the body? Can you have a guess? Yes, your guess is as good as mine. Of course, it's the skin. From head to toe, our body is covered by the skin. And we are fortunate we have melanin as Africans. We also have those who don't have as much melanin as, like myself, do. Some have more than I do, some have much less, you know. But today, we have two experts who will be joining us to talk about how we can care better for our skin. And they will talk about the common skin diseases that we have in Nigeria. Both of them are specialists. You know, we call them in the medical parlance dermatologists. I know you are waiting to see who they are. And yes, at the end of the program, you will not regret, you know, spending your 30 minutes with us. Please follow us on our social media handles, as usual, at Talk Health Nigeria, on Twitter, Facebook, and Instagram. Of course, subscribe to our YouTube channel, Talk Health Nigeria TV. You may also follow me on Twitter at Dr Laz for you. We'll take a break, and when we return, I'm going to be introducing our guest, and we have so much to talk about concerning our skin. Do stay with us. We'll be right back. Welcome back to Talking Health with Dr. Laz, your favorite health program on television. Before the break, I told you we are going to be discussing today about the largest organ in the body, the skin. What can any of us do without the skin? Can you do without a beautiful skin? I don't think anyone does. And we're privileged to have two specialists, top shots in the medical sector here in Nigeria. I have with me in the studio Dr. Grace Okudo, the President, National Association or Nigeria Association of Dermatologists. She's a consultant dermatologist and also a retired Assistant Inspector General of Police. You're welcome to the program, Dr. Grace.
Thank you, Dr. Laz.
Yes, I know some of you may be familiar with her. She was on one of our programs not too far ago. Also here with us is another consultant dermatologist. Consultant dermatologists are like the specialists in skin care, anything about the skin, treating any disease condition that has to do with the skin. So he is also a senior lecturer at the University of Abuja, College of Medicine, and also a consultant at the University of Abuja Teaching Hospital, working in the dermatology unit. Dr. Bob Ukonu, you're welcome, sir.
Thank you, Dr. Laz. It's good to have.
So today I'm going to be having both of you, you know, to talk to us about the skin. Yes, we all have skin, and in Africa, our skin has a lot of melanin. Ladies first, beginning with Madam President. How best can we care about our skin? Let's begin from the normal before we start, you know, talking about the common skin conditions.
Well, the skin, like you've rightly said, is the largest organ in the body. Mm-hmm. And your skin kind of is the first contact anybody will have with the environment, with anybody. So to keep your skin in good shape is good business. Okay. So it is our duty to do that and not to damage it.
So how do we keep it in good shape?
Yes, coming to that, you cleanse it. Cleanse it. That is, you use soap and water.
Okay.
Then you apply moisturizers.
What do you mean by moisturizers?
Something that will not dry the skin, something that will retain water, moisture in the skin.
Okay, like body cream?
Body cream.
Okay.
But not cream that bleaches you.
Not the one that
Bleaches you, because bleaching is not skincare.
So what does bleaching do?
Bleaching removes, I mean, there are different ways you can bleach. You can thin the skin by removing a upper layer of your skin.
Okay.
You can reduce the expression of melanin in your body to make you look lighter as well.
Okay, the conclusion is bleaching is not acceptable. It's actually a full topic on its own, but
yes,
I'll be asking further questions on that. What other care can we provide to skin?
When you are getting older, particularly, you might want to improve the skin turnover. There are things you can use. And also because we have the black skin, we are very close to the equator. And the melanin, we also will help darkening of the skin. So it's always good to use sunscreen, or what you call sunblock.
Sunscreen?
Sunscreen is
like eyeglass or something?
No, sunscreen is a cream. And some of them have, moisturizing effect as well. So it also will moisturize your skin.
Is there a special kind of cream or just any regular cream that we can afford? No,
it has some, the melanin, you rightly say that you have well-expressed melanin. It's not as if the white skin doesn't have. It's just that our melanosome is larger.
Okay.
What carries the melanin? So what happens is that the darkening, because it is very active, very, very active, the effect of UV light makes it even more active, and also friction. That's why between the thigh, you see that you are
that's
you are
the
darker,
sun, right?
You are darker, friction as well, and also the sun, UV light. You find that areas that are exposed to sunlight will be darker. You find people who are very light skinned inside, but outside they are darker. Is this high activity of melanin that is causing the problem? Okay,
thank you very much, man. Let's get to Dr. Ukonu. Dr. Ukonu, what other ways can we, make our skin to be healthier?
Yeah, making sure that you bathe regularly, because there are
once or twice a day?
At least, minimum, depending on the kind of environment where you are.
Okay.
There are people traditionally say you bathe at least twice a day. One in the morning, and then maybe before you go to bed. That also will help to cleanse the skin and make it look, better. Because there are certain bacteria, microorganisms that are quite resident with the skin. We call them normal flora.
Okay.
Yeah, but
so
sometimes
let me double down on that. So there are some organisms that are normal on the skin.
Yes.
Are they harmful?
Naturally, they are not.
Okay.
Naturally, they are not. But in a hot, humid environment, and you happen to have a frictional injury, they also may become harmful.
So by frictional injuries is...
Yeah, people that, depending, there are times that you have people, they feel a little itch somewhere, they scratch so vigorously. Even the use of your towel, vigorously cleaning up the water after baths. These are things that can cause frictional injury to the skin.
Okay, so like the strong sponge, right?
People that use sponge,
the strong one that could have some abrasions. So
it's not advisable to use sponge at all.
Yes.
Well, it's not advisable to use sponge at all. So what does it predispose us to?
It breaks the skin.
I'm sure many persons will be very surprised.
It breaks the skin in the process, causing some of these minute, tiny injuries to the skin, thereby changing the skin's flora. And when that happens, that area may become hypersensitive.
Okay.
Ordinarily, what you thought was normal may become abnormal.
So those organisms that were normal on the skin, when you use any of these that are hard and maybe takes out some layers, so the organisms may possibly infect the skin. Is that
they may become nudis or infection.
So what does that? It comes out as boils or something?
Well, depending the organism that is championing that.
Okay.
All right. That may also it is either a result to, frequent itch around that area and scratching, and that may lead to what we call, some dermatitis in form of lichen simplex chronicus. You just discover that that particular area, you are fond of going to itch there.
Okay.
Fond of, scratching that area of the body.
So, but there could also be other things that may cause the itching, right?
Yeah, there may be other things.
Maybe hypersensitivity.
Reactions can also predispose you to that. It may also come up in form of folliculitis. It may also result in form of boils. So it depends. So we do advocate that at least regular baits in terms of once or twice a day, depending on how.
Okay, just before we take a break, some persons argue about the use of toilet soap or medicated soap and all that. So as experts, is there any kind of soap you think is better for the skin? Coming back to you, Dr. Okudo.
Yes, we have different skin types. Skin types in terms of the dryness of skin and the oiliness of skin, or in between. So the medicated soap will dry your skin. And when you dry your skin, it will dispose it to itching.
Okay.
And also to more kind of skin conditions. So we don't encourage medicated soap. However, when you have a lot of oil on your face and you're treating things like pimples, what you call acne, you can use medicated soap. That is the only time. But if you are trying to, maintain hygiene and all that, you think you should use medicated soap, you want to be cleaner, it's not true. He has rightly said, there are some normal skin organisms that ought to be there. You should not disturb them.
What's their function?
It just maintains equilibrium.
Okay. So they provide some level of protection to the skin?
So you can destabilize, when the skin loses the equilibrium, you can get exposed to skin conditions.
Okay, so you've heard that from the experts themselves. We are going to take a break, and when we come back, we are going to continue with this conversation. Do stay with us and keep making your comments and ask questions if you have any on any of our social media platforms. We'll be right back. COVID-19 is still here, the pandemic is still there. Make sure that you wear your mask properly, covering your nose just as I'm putting it on now. Don't wear for the jaw or hang it up somewhere, and keep protecting ourselves. Welcome back to Talking Health with Dr. Laz, your favorite health program on television. I've been speaking with two specialists on skin conditions, consultant dermatologists, Dr. Grace Okudo and Dr. Bob Ukonu from the University of Abuja Teaching Hospital. Before the break, we were talking about the use of soaps and all that. Coming back to you, Dr. Ukonu, at the University of Abuja Teaching Hospital, from your experience, what are some common skin conditions that you encounter? I know some weeks ago, I think specifically 29th October, if I'm not mistaken, there was World Psoriasis Day that was marked, and dermatologists all over the country and around the continent participated actively in that. So what other, apart from psoriasis, you may speak to psoriasis, let's viewers understand what it means. Please try to use simpler languages. I know we are all clinicians here, but for those who are watching us, they might, want to know what they are commonly called. So what are those conditions, and how can they be handled?
In terms of common skin conditions, I would like to categorize it as follows. One, those due to infections. And then those due to inflammatory, skin problems, and then those due to pigmentary issues. Dr. Okudo has talked about melanin. Part of what will happen if the melanins are not functioning well is pigmentary disorder. So common skin dermatosis that we usually see in our outpatient clinic coming under infections are mostly either bacterial, viral, or fungal.
Okay.
Under fungal, you have dermatophytes, superficial dermatophytes. What that means is that in the common parlance out there in the society, they will tell you they have eczema.
Okay.
Yeah,
eczema is a superficial.
Yes, mostly what they
call. For those who want to learn medical language.
Yes. So it comes like in form of slightly a chalk-colored discoloration on your skin, in form of hypopigmentation. And they have it mostly at the back, and then depending on how virulent it is, it may also involve the chest.
A lot of persons get concerned when they have that. What would you advise anyone that notice that in the body to do?
Yeah, I think the best thing is to see a doctor.
Okay.
Dermatologist.
Dermatology, in many cases, will always recognize that and treat it properly.
Yes, that's
what
ideal, but dermatologists are not in many parts of the country. So assuming someone is in a remote place
in most
and
cases,
identifies that,
yes, in most cases, before many of these patients will even come to us, they would have taken a lot of antifungal, drugs. But because they don't know the pathogenesis and the pathophysiology or the natural history of this infection, they undertreat it and thereby allowing the infections to reoccur.
Okay.
And
yes, coming to you, I know you want to come in there. Looking at it from the systemic perspective, as Nigerian Association of Dermatologists, is there a way of, passing these skills to health workers at the primary health care to be able to identify some of these conditions and be able to handle it in a place where dermatologists are not available? Yes,
we've already done done a study.
Okay.
On it's a form of telemedicine, what we call teledermatology, where people can be seen, seen not physically, but electronically, either by taking pictures, storing it, and showing to a dermatologist, or by kind of a read time, what they call read time, a video kind of conferencing. Okay. So these are areas we've now adopted because we found that we don't have enough to go around.
Yes.
So we are training some critical personnel, general practitioners, some nurses and pharmacists who are going to be, following up this matter. You can be seen, and with the help of this critical mass medical healthcare personnel, you can now see a dermatologist via teledermatology.
Okay, one may want to ask, what of a location where these telemedicine facility is now available?
We are piloting it.
Maybe there's no phone or no internet and something.
You'll be so surprised. In Nigeria, almost every section, almost every rural area has that kind of facility.
Okay, so if you want to go...
You can use your smartphone.
Yes, but not every Nigerian has a smartphone.
Yes, that is why you need the critical mass healthcare practitioners that will help you to link you with your dermatologist.
Okay. So I pray that works out very well.
We are piloting it now.
Yes, especially because even in some states, health workers are being owed salaries. So even when they have smartphone, they may not have money for data. So, but that's entirely a separate one. But I'm really happy that is already being championed.
Yeah.
Yes,
because so that a lot of persons get so much concerned about their skin. Our time is already very fast spent. I know you're very passionate about psoriasis. Yeah. Could you, before we round up quickly, speak to it? Is there any local language we know it better with, and how can it be prevented and treated?
Well, psoriasis is a it falls under one of these inflammatory skin dermatosis. And they do run a chronic course.
That is long time.
Long term.
Yes, it's run a very long chronic course. It presents in two forms in terms of bimodal presentation. Bimodal, that means that it can come when you are still a child, and then can also come at an adult age.
Okay.
And when it happens like that, most commonly what people will think is still the same eczema or ringworm.
Okay.
What people mistake as eczema or ringworm
may actually
turn out to be psoriasis. And so that is why it's important, this kind of enlightenment, that people get to know about it.
Okay.
Yes, because
so
majority
in that case,
of time,
if someone has any of this and been treating it with the common
majority
drugs
of time they would have treated with a whole lot of antifungi before
So
seeing us in the teaching hospital.
Wow.
And just a skin biopsy would confirm that you have psoriasis. All right? And because depending on the part of the body that is involved, it can be very, very, devastating psychologically. Majority of people that have psoriasis, because of the chronic course that it tends to run, find it difficult to be socially,
They tend to withdraw.
Yeah, they tend to withdraw themselves. They think that they are social misfits. And more especially when it involves the palm, the fingernails, or the face, or the genitalia, these are very, awkward areas that each time it involves them, they tend to be psychologically deranged. So, but psoriasis is something that can easily be managed. Okay. And when it is being discovered on time, it can easily be talked out of it, it can easily be followed up properly.
And easily treated, especially when someone meets the experts that can handle that.
Yes.
Last words now, because our time is up. Dr. Okudo, there is cancer of the skin affecting mostly people with living with albinism. There's melanoma. There is so many other things. There are people who are doing even surgeries and all that. Each of them consider a full topic on its own. But what could be your last words to Nigerians, as it has to do with their skin care?
Incidentally, some of our members are working on albinism. And, of course, sensitization is very key. Use of sunscreen. Extremely. And we are working with some organizations to help them get this sunscreen available. Not just use of sunscreen, also shading has been found to be useful. Yes. Using the right hat, right clothing and all that. But it's something, in a different locality, luckily or happily, the Albino Foundation is also doing some job. We are working hand in hand with them. Okay.
So thank you very much, Dr. Grace Okudo, consultant dermatologist and president, Nigeria Association of Dermatologists. Thanks for making our time once again, for being with us. And also thank you, Dr. Bob Ukonu, all the way from University of Abuja Teaching Hospital, senior lecturer at the university, and also a consultant at the teaching hospital. We wish to continue. There's so much, but if you don't pick anything, the skin is very important, and regular bath, using soap, not the medicated or antiseptic, but just soft ones, and also seeing health workers when you have any challenge about your skin. And if you've been treating what looks like ringworm or eczema and it's not been going away, there are chances it could be psoriasis. I don't know how to break that language. So we'll see you again another Tuesday, same time, same station. But don't forget to follow us on our social media handles, and let's keep the conversation going. Bye for now. My name is still Dr. Laz Eze. See you soon.